Thank you, Mr. Chairman. This is an important debate, important hearing, important topic, so it has tremendous budget impact, and I think it's something the nation needs to be talking about. But how does something become a law? You vote on it. So here's what I'd like to see happen. I'd like to see a vote on your proposal in this committee this year. I welcome a vote on Medicare for All in this committee this year. You have control of the Senate floor. I welcome a vote on Medicare for All on the floor of the United States Senate this year. You tell your side of the story, we'll tell ours, but if you really want this to become law, you need to start voting. So, Mr. Chairman, I'm hoping that after this speech that you will be putting your idea up for a vote. And if not, why not? Because most of your colleagues would jump out the window if they had to vote on this. After this discussion by Senator Sanders, you're wondering why we need a wall at all. The state of health care described by Senator Sanders, it certainly can be made better and needs to be reformed, absolutely. Can we spend less and get better outcomes? Absolutely. But to believe what was being said, why are so many people coming to America? Why aren't we leaving to go to someplace else where you don't die in the streets? So the facts you're describing and the activity of the American people really don't match up. If it were, as you said, one of the most disgusting examples of healthcare being provided on the planet, people would be leaving America, not coming to America. Under your proposal, every doctor and nurse, in case you're watching this, you would become a federal government employee because the only game in town would be Medicare. You'd be working for the federal government because the single provider for healthcare in this country would be Medicare, which is a government-run program. The private healthcare that you have today as an American would go away. Once you get to be 65, Medicare takes over, but below 65, people are insured in the private sector for the most part. That option goes away for you. Everybody in the healthcare system becomes a federal government employee. Everybody in America goes into a single payer system run by the federal government. Let's see where we're at with Medicare as it stands today. Medicare is an important program. I'd like to save it. I don't want to sunset it, as some people are talking about. I sure as hell don't want to invite hundreds of millions of people onto the Medicare system that haven't paid a dime, because Medicare for All really becomes Medicare for nobody over time. This is what the trustees say. Medicare Part A, which is the hospital part, will become insolvent by 2026. To rectify the $5 trillion shortfall over 75 years, you have to increase taxes by 27% or cut spending by 16%. Medicare spending expected to surge from 4% of GDP to 6.2% by 2045. We found common ground here. We need to change that narrative. We need to reform Medicare, not invite a bunch of people onto the system that would sink it. So it's in a fiscally unsound situation. I'd like to work with Democrats and Republicans to make it sound. Which would be a worthy use of our time. Now, just to remind people what life's like in America today, inflation is like beyond through the roof. 22.7% for used cars, 43.6% increase in gas prices, fruits and vegetables, dairy products, just go down the list. We're talking about the most massive increase in spending known to the United States. How would that affect inflation? Not well. So absolutely would crush an economy that needs some help. So when Americans understand what it means to do away with private health care and replace it with a one-size-fits-all, they're not so happy. Delay in getting medical tests and treatments. 70% say they would oppose a system that created greater delay. You know, Americans have become used to certain things. We like to go to the doctor of our choice. We'd like to have say about who our doctor is and get timely services. Our friends in Canada, it takes 19.8 weeks on average to see a doctor. There's 1.2 million Canadians on a waiting list for critical medical care. UK, it takes 62 days for cancer patients to start treatment. 5.8 million British residents were on a waiting list for critical medical treatment. That's their system. If you think it's hard to get to see a doctor now, Medicare for All would institute delays that I think would be unacceptable to the average American consumer. Financing for Medicare for All. All right, what would it take? One size fits all for a health care plan could cost as much as $40 trillion over the first 10 years. Taxes would double, or you'd have to cut the budget. Healthcare spending grows to 40%. GDP drops by 10% because you're crowding out the private sector. The economic consequences to this plan for the American taxpayer would be unimaginable. And it's hard enough to create a job in America now. You talk about exploding the size and cost of government. This would just absolutely crush the private sector. There are better ways. Let's save Medicare as it exists. But for people under 65, let's try to get better quality by getting the health care dollars outside of Medicare in the hands of people closer to the patient. Governors are innovative out there right now. Let's get money down to the states, give flexibility in inventing new preventive health care systems, and give consumers a choice they don't have today. Right now, Medicare is run by people you'll never meet, and we need to reform Medicare. We need to save Medicare. But the system outside of Medicare, which is a lot of money, let's get it down to the state level. Let's come up with ideas that would lower cost and increase quality. Let's create competition in the healthcare sector where innovation is rewarded, not punished. And I think that is a better way. I want to put healthcare in the hands of people that you actually will meet and have responsibility at the ballot box. So if you don't like what you're getting, you can change the results. So, Mr. Chairman, this is a debate worth having. I applaud your passion. I don't agree with your idea, but here's what I would suggest to you and others who believe in this idea. Let's vote on it. I am welcoming a debate and a vote. Now, if we don't vote on it, then it makes me wonder about it. If you think it's this great and it's wonderful and it fixes all of our problems, let's vote. Thank you.